The total number of COVID-19 cases in India has exceeded 2 million. It's taken just 3 weeks for infections to double. India recorded more than 62,000 infections in the last 24 hours. That's the largest single-day spike so far. It's also the first time the figure has surged past 60,000. Now for more, let's speak with Ishan Garg. Ishan, 1 million cases added in just 3 weeks. Experts are warning the infection numbers could be even higher, though, than reported. Are absolute numbers a good measure of, or should we be looking at, say, infections per million people?
A number of experts have recently pointed out that a number of cases that are going into hospitals are being misdiagnosed as perhaps influenza or influenza-like other illnesses and not COVID-19. And that's one of the reasons why a number of experts believe that the real number of infections could be much higher. And on top of that, you've got the problem of inadequate testing, where a number of experts are saying that India needs to be testing close to 1.5 million people every single day, and it's testing about 400,000 people. And as for if we should be indeed looking at infections per million people, a number of experts, Steve, say that that could skew the optics a little bit, because given the size of India's population of 1.3 billion people, any problem appears to be a smaller one if seen as a proportion of the population. So which is why experts are saying that these 2 million cases need not be seen as a proportion of the population, but as 2 million individual people whose lives could have been in potential danger because of the COVID-19 pandemic. Now, the government is saying that it needs to reopen the country even further, and that people need to learn to live with the virus, and that perhaps is going to be a major thorn in the side of when it comes to cooperation between the government and the expert.
Irshan, so India's COVID-19 infections, they seem to be sweeping from megacities like New Delhi and Mumbai into now smaller cities and rural areas. Is that a cause for concern?
That's certainly a cause for concern, Glinda, and primarily because a number of laboratories which have been set up to test the samples for COVID-19, they're largely in urban centers. So if somebody does want to get tested for COVID-19, but they are in rural areas, they will take a longer time to get their sample to the testing center. And then there is the bigger problem of healthcare infrastructure being completely inadequate in smaller towns and cities. And on top of that, we're also seeing a lack of awareness about the virus and just a bunch of misinformation about how the virus spreads. Having been to a smaller town just very recently, I can attest to the fact that a number of people are not wearing masks, are not following social distancing, and do not have a very clear idea of how COVID-19 spreads. And as the situation gets from worse to worst, we could see the smaller cities and towns becoming the next hotspot for COVID-19.
Ishan, we understand that the burden on the healthcare system is straining. Recovered COVID-19 patients reportedly returning to hospitals with respiratory issues and low oxygen levels. Are hospitals ready and able to cope with those numbers?
Well, the short answer to that, Steve, is no, they're not. They're already overstretched because of the rise in cases of COVID-19. And on top of that, from what I've been given to understand from doctors who work at the top medical institutions in India, they say that the people who are coming back with issues like this and had been cured of COVID-19, they're not being seen as COVID-19 patients anymore. So their treatment is kind of taking a back seat as of now. And it's not just these patients. There are patients who've got heart problems, people who have suffered strokes. Their treatment has taken a back seat as well, because a lot of the resource that the government has at its disposal has been allocated towards treating COVID-19. Now, the government, what it needs to do, according to experts, is that it needs to not only amplify the healthcare structures in place, it also needs to put in more medical personnel into the workforce, and perhaps that way it will be able to tackle this problem.
All right, thanks for that. Ishan Garg speaking to us from New Delhi.